Hi, I'm Dr. Varkey. Today I'd like to revisit a topic I've discussed in a prior video, specifically HPV. This is again a sexually transmitted infection, and it's important because it can cause cervical cancer. The reason I'm covering it this week is I've also covered other STIs this week, and I think this is an important one that many people don't understand. HPV comes in many different types. We've identified over 150 different strains, and we've categorized them into low-risk and high-risk strains. The low-risk strains can cause genital warts, but the high-risk strains can cause cancers. Most commonly, the high-risk HPV strain can cause cervical cancer, but it can also cause vaginal, vulvar cancers, anal cancer, mouth and throat cancer. So it's important to understand it. The scary thing is it can be transmitted just through skin-to-skin contact. So even if your partner is using a condom, you can still catch any of these low-risk or high-risk strains because it's all about skin-to-skin contact. So wearing a condom does reduce the risk of getting the infection, but doesn't prevent it 100% because it can be transmitted if the labia and the scrotum are touching during sex. It can be transmitted through very intimate contact, touching each other, or even oral sex. And this is important because many people are under the impression that using condoms prevents 100% of sexually transmitted infections, and that's not true. The good news with HPV is most times when a patient gets infected with HPV, specifically with women, it's cleared from your system within 1 to 2 years of catching it. 90% of young, healthy women will clear it from their system within about a year, after about 2 years. 80% will clear it by the end of 1 year. So that's why, thankfully, we don't see a lot of people running around with cervical cancers or any of these other cancers we've mentioned. But when it does occur, it's due to HPV, in the case of cervical cancer especially. So it's also important to understand that this virus, the high-risk HPV virus, is very prevalent. As I mentioned, there's 15 different strains, and at any given moment, as many as 30% of the population, sexually active population, carries one of those 15 strains. So there's scary news here, which is that this virus is very common. 1 in 3 people have it that are sexually active. 2, it can be transmitted even with condom use. And 3, it causes cervical cancer. The good news is most of you guys are going to clear this virus on your own within 1 to 2 years of catching it. But in case you don't, that's when you need to go in for checkups. And the doctor will do pap smears and check for HPV, and if that comes back abnormal, we'll do other procedures to look for precancerous cells of the cervix. In terms of prevention, the main thing to do is consider the vaccine, which I've already talked about in other episodes. Condom use helps, but it's important to not have casual sex and multiple partners, to try to minimize the number of sexual partners you have, to reduce the chance that you'll be exposed to this virus. So that's it. I hope this was helpful. Please be safe, and thank you for tuning in, and don't forget to subscribe.